Well, welcome to Take 10. We're so glad you're with us. Take 10 comes to you every week as a podcast dealing with a variety of mental health and related issues as they impact caregivers and care recipients. I'm Ron Aaron, along with our co-host, Tina Smith, filling in today for Carol Zernial. Tina is Senior Director of Caregiver Program Operations through the WellMed Charitable Foundation. She earned a bachelor's degree in psychology and a master's degree in social gerontology. And Dr. Jamie Huysman is our other co-host today. Dr. Huysman is Chief Compassion Officer at WellMed Medical Management. He's known nationwide for his work in caregiving as well as addictions. And Dr. Jamie, let's kick it off with something I know is near and dear to your heart, Mental Health Awareness Month. That's what May signifies, although it ought to be awareness 12 months a year. What's at the top of your agenda when you talk about mental health awareness?
Well, it's beautiful to work with the WellMed Charitable Foundation along with our foundation, the Star Network Foundation. Interesting enough, we separated the medical and the behavioral health world years ago. It's not served America well in terms of healthcare delivery. In fact, I think it's created huge problems. But even in the behavioral health world, we've kind of separated, if you will, mental health, addictions, trauma. Why? I have no idea, Ron. So today, I really believe our foundation and the WellMed Charitable Foundation is helping support this, is how are we bringing trauma-informed mental health care now to consumers everywhere? Let's face it. PTSD is always been in our minds, whether you're military or you're a cop, fireman, or God forbid, you went through physical, emotional, sexual abuse. PTSD is life-changing. Complex PTSD or childhood PTSD and the traumas of a very tough childhood is not so much, but it plays deeply into the medical world of so many people and the mental health world. So this month, Mental Health Awareness Month, our organization is trying to get trauma-informed mental health as opposed to strictly, quote unquote, mental health awareness month. How's that?
And what does that mean?
Well, that means we need to be mindful. We need to see it through the lens of not just depression, anxiety, bipolar, addictions. We have to see it, and we're doing this at WellMed a lot. I do it as Chief Compassion Officer, trying to work with our doctors in looking at their patients, saying, instead of what's wrong with you, what happened to you? Meaning the things in our childhood, the adverse childhood experiences, the social determinants of health, food, bad, home environment. All these figure into what we call trauma or complex trauma or adverse childhood or adverse experiences. We don't in mental health enough integrate that into our own psychiatric, psychological world. And I must say the medical world doesn't integrate it hardly at all. So it's important for us to start seeing things not through the lens of who I love Freud and I love Jung, and they always built this world for us, but see it through the empowering model of how do we kind of get well and reparent ourselves in this kind of trauma-driven world around us.
And to do that, do you need help or can you do it on your own?
Both, very much both. I do believe you need to always get a licensed trauma-certified therapist who can help guide you on the train tracks. That's whether you're a parent or certainly a caregiver, most definitely, because that's when these ghosts and goblins of complex trauma come up as some family caregiving. But you can also do this, interesting enough, on your own, that we actually can become our own trauma coach. It's not a huge rocket science how we get well in this world. You don't have to come see me every week and tell me what happened at 10 years old with your mom anymore. You can embrace yourself, especially as a caregiver, start doing stress reduction, feel your body, feel the dysregulation, the sleep or walking on eggshells. But make sure you hang around healthy people like a caregiver SOS, your church, your synagogue or ashram, because the key to trauma recovery is really embracing ourselves, stress reduction, and doing it around healthy people that meet us halfway and don't dominate us.
Tina, what do you think?
I think that's true. I mean, self-care is something that often gets put on the back burner by a lot of caregivers. They're so busy focusing on the person they're caring for, they don't think about themselves. And so they get lost in all of that. But, to Jamie's point, it's just you need to, really surround yourself by good people and take those steps to take care of yourself.
My ex-wife, who I call my best friend today, Betsy. So I mentioned to you once, Ron, that she's in recovery for alcohol dependency. She's got 17 years of strong recovery. She's doing amazing. She sponsors the world. She's healthy as they can be. When she had to go up to Jacksonville and take care of her 91-year-old father, Listen to me here. Everything got triggered. The ghosts and goblins of childhood, the challenges of the children should be seen and not heard, being put in the corner, the timeouts, the father who never took accountability for his stuff. And she called me up one day. She said, Jamie, it was almost easy to get in recovery for alcoholism. She said, the complex or the childhood trauma, it's every day a problem. It's coming up in me, and I have to call my sponsor and my therapist. So family caregivers, beyond just taking care of their mind, body, and spirit, need to be mindful of all of those ghosts and goblins of childhood that come popping up when they're taking care of their family loved one.
Let's talk in a minute about where you can go for that kind of mental health help. First, I want to let folks know who may have just joined us. You're listening to Take 10. I'm Ron Aaron, along with Tina Smith, who is filling in for Carol Zernial, and Dr. Jamie Huysman. So, Dr. Jamie, you often point out quite correctly that folks must find a therapist, may not be able to deal with all this alone, but how do you find one, and how do you afford one?
Well, that's a great question. Number one, the affordability I'm going to answer right after. You find one, there's a couple of great search engines. Obviously, if you're an employee of WellMed, we've got a great, EAP. But if you're a caregiver listening to this, a patient or anybody, you can go to two separate places and start finding one. One is psychologytoday.com, who I write for. On the front page, it says search for a therapist. Just put your zip code in. Out will pop 5 to 10 therapists. Make sure they're trauma trained and that they understand boomer and senior care or geriatric care. Another place is psychhub.com. You can go there and find one as well. Now, to answer your second question, you do have to talk to people on the front end always about the dollars and cents. And some will go and allow you a discounted price and probably work on a sliding scale basis. But if you come to our meetings, tarnon.org, or go to the Star Network and find them, we have 5 meetings a week, 1 hour, virtual. We call it Tarnon, and literally it's free. It's free, virtual, jump right in. You'll get a lot of recommendations because we see people from all over the country and all over the world. And you can start finding people that maybe you can afford and finding therapists that are really good and trained up in this.
Here in San Antonio at Jewish Family and Children's Service, they offer free counseling for those who can't afford it.
It's great. And hopefully they are licensed and trauma trained, because that is fantastic. A passionate therapist who facilitates, also doesn't tell you what to do, but gives you a safe room. And I keep telling everybody this. The beauty of safety, Carl Jung said 80% is feeling safe with the person in front of you, 20% what happens afterwards. Caregivers need to understand we need a safe place to cry. We need a safe place to discuss this, and with maybe somebody who knows a lot more than we do about the concepts of aging well. And so having one is the greatest insurance marker in the world. And whether it's through Jewish Family Services, which is a wonderful, wonderful service that you're talking about, Psychology Today, or coming to tarnon.org, reach out. It's a superpower. Get well, get help. And get in a trauma-informed way, which means they'll understand your childhood and what's popping up in this caregiver experience.
Now, Tina, you also offer through Caregiver SOS on air, through the Caregiver SOS program, a teleconnection that can help folks.
Absolutely. Yes, we have experts from around the country, such as Dr. Huysman, Dr. Jamie, come share information related to caregiving. And if you're able to attend a live section, you're able to ask questions of the expert and get some good feedback from the expert as well as the other caregivers on the line.
And that's at no cost.
Absolutely. It's free. We record all the sessions. We have about 6 to 7 a month, and we record all of them. So if you can't attend a live session, you can always go back and listen to one of the recorded sessions.
Dr. Jamie, if you were to do a list of 1 to 5, the biggest challenges and mental health problems facing caregivers, where does depression rank?
Well, depression always ranks number 1, believe it or not, whether you're going through trauma, whether you're going through almost any issue. Depression, which takes you to another place, whether it's clinical depression and it's biochemical, or situational depression and it's the feeling of hopelessness, that's number 1. But as I often say, and you hear me say it too often, that sometimes can be well avoided. Obviously, if you're feeling depressive, symptoms for over 4 to 6 weeks, you go see a psychiatrist and you get a good psych eval and you take a look, because the medications and education and going to groups at Caregiver SOS will really help.
Got to
But
stop you right there.
Help you. Let me help one
Jamie.
second. You got to isolate. Don't isolate. Don't isolate. Don't isolate. That's your first step out of depression.
Out of time. Thank you, Dr. Jamie Huysman. Tina Smith, I'm Ron Aaron. Thanks for joining us on what now turns out to be Take 10.2 Seconds.